Go ahead.
Okay. So the individual will come in here and be greeted by a client flow coordinator. We want to make sure they're wearing a mask, and then we can go ahead and direct them to registration. We have up to 8 registration people. We will back down or ramp up depending on how big the clinic is. Right now we've got these first 4 lanes going. As you can see, we've got 6 feet social distancing to make sure that we're inside. We want to make sure we're doing that. So they'll come up here. Excuse me, now I'm coughing. They'll let the person know they've already registered at home. Okay. They do need an appointment. They'll let the person know their name. They'll go ahead and print off their form and provide them a couple educational sheets, and then they'll be instructed to walk through here. It looks like a lot, but we've got arrows, and again, we can ramp up and down with these ropes. If we've got a smaller clinic, we can just, these things come off, and we can do that real easy so that people aren't having to go back and forth when there's only 5 people in line.
How many people, I mean, when this is all full, can you stage?
I have not done the
Okay,
numbers.
that's fine.
I can tell you that 80 people can be in that line there. And we've got 16 nurses that can probably vaccinate one person every 5 to 10 minutes.
Sure.
So
Sure.
I should do the math, but I haven't yet.
Well,
I haven't gotten
that's
enough
fine.
vaccine to make
That's
me do
right.
the math
That's
yet.
right.
So give me the vaccine and then I'll do that.
exactly.
This is form review. What they do is they come in here. Again, we've got the lanes. These people check to make sure that there's no contraindications to getting the vaccine. There's questions on the form. There is. They highlight them. They make sure that they're the right age. We don't want anyone under the age of 18 getting vaccinated with Moderna or under 16 with Pfizer, which we don't have Pfizer yet. I fully expect that we will, but
Okay.
there is a nurse that is stationed here as well. So if they do indicate that they have a contraindication, the nurse will talk to them. Sometimes it's they just didn't understand the question, and we'll fix it. Sometimes it's they understood the question, but maybe they didn't answer it right. The one is, do you have a severe allergy to vaccines? And somebody might put yes, and it's that they have a severe allergy to eggs or something, and that's okay with this particular vaccine, which we're not used to that because with flu vaccine. So if the nurse says that, nope, we're okay, we can go ahead and get you vaccinated, they'll direct them in that line. If they can't, that's our exit, and we'll just have them exit and have them talk to their physician if that's a reason.
Right.
Sometimes we'll have pregnant women, people that are breastfeeding, they'll want to talk to their physician first. We won't ever tell anyone they can't get it, but we will tell them, talk to your physician, and if they say it's fine, then go ahead. So then they'll, depending on which side of the table, they'll come around and they get to go into this windy thing, kind of like Adventureland, I'll say.
Okay.
I haven't been there in a long time, but we're going to take a shortcut and pretend like we went through all that.
Didn't want to get your steps in?
No, it's too hard. And so here's the next stop. There is going to be another client flow coordinator, just like over here,
Okay.
and they're going to stop the line until a vaccinator is ready. And then once they know which vaccinator it is, they'll tell them go to station number 6, whatever one is open.
Sure.
And there, basically what we have is a table here that we have 2 vaccinators, so we can vaccinate 2 people. So we're still trying, again, to keep that social distancing. The nurses, this is their way of letting the client flow coordinator know that they're open, so that they can send another person. When they are done, here's another client flow coordinator. If we are having both areas going, it's just easier to have another one here just because of the distance that they can direct them. We do have to have the vaccine entered into the Iowa immunization registry within 24 hours, so we do have a data entry team back there that we are entering information in on site so that it's in there. This is our first aid area if we have any issues that people need to take a time out and get some nursing attention. Hopefully we won't have to use it, but we have it if we do. And then this is our education area and our 15-minute waiting. They want us to have people wait 15 minutes, make sure that they're doing okay. So they'll just sit here and wait. I don't know. Were you here when I did
Yeah.
that part? Okay. Do you want me to finish it?
Sure.
Okay. There's video here that will give us information about the vaccine, what to expect. We do know that this vaccine has side effects that we're probably not used to. If you've ever had shingles vaccine, I think that's probably the closest. First dose isn't quite as rough as the second dose, and so there's information so that they know to expect that.
Like you mentioned, you basically had a basic plan already back in February to have some sort of a layout, not probably knowing where or what, but kind of having this layout, right?
Yeah. We kind of knew, we know what stations we need. The biggest thing is with this particular virus is the social distancing. You know, when we did H1N1, there was a lot of people in there, and we can't do that. We can't just open the doors and let the public in this time.
Right.
We need to make sure that there's social distancing going on. So getting people scheduled, making sure we have a big enough site that we can spread out the crowd was a huge goal of ours.
Obviously, having the vaccine, getting the vaccine here and having enough so people can come in, that's obviously been a tough issue, or not really?
No, actually, our community has been pretty responsive to the vaccine.
Okay.
We've been talking to different agencies, asking them to find out, their employees, the interest of this vaccine. And we're running around 60-70% at a lot of places, which is good, because there has been so much misconceptions of the vaccine, and some, they're not sure. And this is a new vaccine, and we don't have all the answers to everything. We know what we know right now. And so I just tell people, get some information, make sure it's a credible site, read it, and if you feel that this is a thing you want to do, then come get vaccinated.
Got to get the 1A group finished before you can move into the 1B group, right?
We do. And with the numbers that I have, we're at about 91% by the end of the week. So we're real close.
Thinking maybe after February 1st, or what, that 1B group would start, or I know you hate to always put dates on it, but
so long as vaccine comes, I think that we can hit the February 1st. Now, when I say we're 91%, that's with the primary dose. That's not getting their second dose. So
probably the one thing you probably want to get across to the public is don't come in unless you've made an appointment, right?
Correct. Because we have the amount of vaccine and the amount of appointments that we have available, they match. And so if you come in, we don't have vaccine for you. We haven't reserved it because you don't have the appointment. So make sure you get an appointment.
Anything else you want to add?